Hi, I'm Tabitha Butcher, and this is my week 5 assessment video. So we are looking at a patient with atrial fibrillation or right-sided heart failure. So first we would do a health assessment or history with this patient. So we would go through and ask them if they have any family history of any cardiac issues, do like a 24-hour diet recall to see what they typically eat. Some expected findings we would see with like AFib or with right-sided heart failure would be like shortness of breath, any fatigue, or just general weakness. They might have some swelling or edema like in their lower extremities. We would see a rapid or irregular heart rate and then possibly even a persistent cough. So once we go over the health history, we would do general appearance. So when we come in and first see the patient, we want to check their skin tone, see if they might be a little bit pale, sweating. We'll check their nails for any clubbing, and if we would check their capillary refill. So if it's less than 2 seconds, that would be normal. But this patient, it might be over 2 seconds because they're not getting the greatest oxygenation sometimes. We would also look at their like abdomen and chest area. We would view like the front chest and then the back chest, and that's when we move on to looking at like the thorax, back, and lungs. So we would do inspection first, see if everything is normal there on the front and back. We would evaluate their symmetrical expansion. So like before, we're going to put our hands about their mid-back and have them breathe and see if our hands expand with their breathing. We're going to look at the spinal tenderness. So again, we're going to put the hand up and we're going to kind of hit in the kidney area to see, we're going to assess for any infection, see if their kidneys might be a little bit tender. We're going to auscultate with our stethoscope the posterior lungs, and then we're going to do the anterior as well. We're going to do right and left, so the 3 lobes and then the 2 lobes, and see if we hear any crackles, anything in the lungs. We're also going to, things that we would see again, that this patient might have a cough and they usually have shortness of breath, but unless they have another issue like COPD or something, they typically shouldn't have any crackles unless they have some fluid on their lungs associated with the edema, so that might be noticeable. Next, we're going to do the actual cardiovascular assessment. So we're going to check the nails and capillary refill. We're going to look at their skin turgor, see if they're dehydrated at all. We're going to palpate the point of maximum impulse, and we're also going to use the diaphragm of the bell of our stethoscope to locate the diaphragm. We're going to do the pulmonic, aortic, the tricuspid and mitral valves, and listen for the S1, S2 sounds, and assess the peripheral pulses down like in the feet, and then the brachial and radial pulses as well. We want to count each side and do it for a full minute when we do those. Last, we're going to check the abdomen area, inspect for like contour, symmetry, any skin characteristics that might be going on, if they're sweating, anything like that, which they might be. If their heart rate is up, they might feel a little bit exhausted. And then we would percuss all 4 quadrants of the abdomen, and we're going to do some deep palpation as well as light palpation. And you shouldn't have many abdominal issues like gastro issues with this. Normally bowel sounds are present. This is mostly with cardiac, so they shouldn't have any issues with that. And again, we're going to do things like EKGs, maybe a transthoracic echo, do a Holter, and see what's going on with this patient for further testing, do some labs. And then we would probably refer them to a cardiologist or an electrophysiologist to see, along with their heart failure or with their atrial fibrillation, what other issues that might be happening or what is causing those issues.